I'm Dr. Evan Allen from Allen Wellness and Medical Center. I'm a board-certified family physician, and we are doing a series on wheat belly and grain brain. This is part 3. The book Wheat Belly discusses risks of wheat consumption as associated with type 1 and type 2 diabetes. And the book is very misleading and makes you think that wheat consumption is actually the cause of the epidemic of type 1 and type 2 diabetes, when really nothing could be further from the truth. The evidence actually goes exactly the opposite of what Wheat Belly tries to establish. In type 1 diabetes, the incidence of type 1 diabetes from country to country varies as much as 300 times as much type 1 diabetes in countries with high rates as it is in countries with low rates. And the characteristic that's most associated with the development of type 1 diabetes in both children and adults is the consumption of dairy products and meat. And this is so well established that large-scale reviews of the analysis and studies that have been done have made a recommendation that children avoid dairy product consumption. And the American Academy of Pediatrics recommends no dairy products for a child until age 1 because of the risk of type 1 diabetes. Contrarily, there is no widespread recommendation for any group other than people with known wheat problems, like celiac disease sufferers, to avoid wheat because in most studies it's actually protective against type 1 diabetes. Type 2 diabetes is more of the same. The risk factors that cause type 2 diabetes are well established. They're high-fat foods, dairy products, eggs, cheese, and meats. And yet, Wheat Belly is recommending nearly unlimited consumption of these products and telling you to avoid wheat. Well, what happens when we look at wheat separately? Wheat is protective against type 2 diabetes. The health professional study shows this. Both of the nurses' health studies have shown this. And many other large-scale trials and large-scale populations have shown basically the more whole grain you consume, including wheat, the less diabetes you have. So the book simply gets this completely wrong in a way that is very misleading and would lead people to think that something that is protective was actually harmful. We have a blog post up if you want to read more about the individual facts in this case. And we're very excited to be bringing these reviews to you. And stay tuned for our next review, which will be coming up. Thank you.